Hello there, and thank you very much for opening up this video. I really do appreciate it. For those of you who don't know me, my name is Bond, James Bond. I'm a health and fitness expert based in the United Kingdom. And here today I'm talking to you about something which hopefully you'll never experience, but can be very frightening for people, and that's a panic attack. Now, a panic attack can occur to absolutely anybody, even the most strongest willed person, the person is exposed to high stress. It can affect absolutely anybody. It doesn't discriminate. Let me tell you a little story. About a year ago, I was in the Co-op supermarket in Ormskirk, and a young lady came in, and she was in terrible distress. Now, being a former doctor myself, I recognised that this person was having a panic attack, and I took her to I told her to get into my car, and I took her to hospital, and luckily she got the appropriate treatment. But no one else knew, but I suspected. Now let me tell you some of the commonest signs and symptoms of a panic attack. First things first, it is incredibly frightening for the patient. When I mean frightening, I mean absolutely horrifically frightening, okay? The patient's heart rate might suddenly go up, so they feel a terrible beating of the heart against the chest. Their blood pressure rises, okay? Start crying, face goes red, okay? Feel nauseous, a bit anxious. Maybe a feeling of crushing chest pain, sweating, palpitations, start breathing extremely rapidly and shallow breathing. There's a whole range of symptoms, okay? In some cases, the patient may feel the urgent need to pass water, okay? They might wet themselves. Now, it's a very, very incredibly frightening experience, and I don't wish it on anybody, because basically the patient may feel they're going to die quite quickly. Thankfully, it doesn't come to that. Very commonly, if they do suffer from a panic attack, in this particular case, what happened was the nurse practitioner got a little bag, got the patient to breathe in and out of it, okay? And that basically went a long way to help prevent it. Now, in the long term, there are some wonderful treatments available. Yes, there are medications available, but let's try to avoid that route if possible, because all medication carries some degree of side effect. I would suggest a cognitive behaviour therapy with an appropriate counsellor. That's extremely effective. There's a thing called systematic desensitisation, which is a brilliant treatment to say the very least. If it's triggered off by certain things, they can use a treatment called flooding, which I do not recommend. There's all sorts of ethical implications of that, and there are some medication involved. Exercise is also a great reliever of anxiety. Now, what I'd like you to do is go below and you'll see a link to an article from my online magazine that tells you a lot more about it. Have a read, and there's my newsletter there. Get on it. My name's Bond, James Bond, leaving you shaken but not stirred. Bye bye.